Over the past month and a half, our department has cared for extraordinary numbers of severely ill patients with COVID-19. We have cared for many through end of life and have been challenged in new ways, with significant change occurring daily, even hourly. In emergency medicine, we are well trained and used to responding to the severely ill and to patients with variable conditions that enter our doors 24/7, 365. That is what we do. As an emergency physician for over 20 years, never before have I witnessed the heightened level of anxiety as that which surrounds this illness, much of it due to the many early unknowns of COVID-19 in its presentation and disease progression. Our faculty, trainees, and staff have demonstrated an extraordinary level of grit, resilience, and courage, which could never before have been imagined. They have comforted patients and families and delivered tragic news with skill and sometimes tears in this new surreal reality with which we have been faced. I have never before been more proud to be an emergency physician and to work with a truly amazing group of human beings. In response to the challenges with which we have been faced, we have quickly innovated protocols across our department, medical campus, and our hospital system, fast-tracked new guidelines and programs for patient care and follow-up, and collaborated with other departments for redeployment and improved patient progression. As we have started seeing decreased numbers of severely ill patients in our EDs, we've begun to strategize about our journey to a new state of normalcy, how we can optimize future operations, learning from the new programs and processes adopted during this time of crisis, how we can best engage our community and provide the highest quality of care when patients may be sick with other illnesses and have been very hesitant to seek care, and how we can best support our frontline healthcare workers who may be better able to reflect on what has occurred once the adrenaline surge from months of action begins to subside. I worry that our communities have been stricken by so much tragedy, anxiety, and trauma that we will all be in far greater need of mental health care, support, and wellness resources. We all need to be aware of this and check in with those around us, including our colleagues, our friends, and our neighbors. We need to ask how people are coping and processing all of these emotions beyond the masks that may cover our expressions, the social distancing, and the distant video meetings to which we have quickly become accustomed. There has been a heartwarming outpouring of donations like personal protective equipment, meals, gifts, and countless expressions of gratitude. We've received extraordinary support from healthcare providers coming from all other parts of the country to assist in caring for patients, and those providers performing skills different from their usual jobs. There's been a newfound level of collegiality born from coming together in a time of crisis, working in someone else's shoes, and rising up to accomplish new things together. I ask and hope that we continue these acts of kindness and collaboration during this prolonged crisis. Continued acts of kindness and empathy will be needed as we enter a new phase of living, with the downstream impact of the medical and mental health outcomes yet to be seen. Our collective strength, collaboration, and kindness unified us through this first phase of COVID-19 and will undoubtedly allow us to succeed in navigating the phase ahead.